give your heart a little TLC like these folks are doing, and they're also watching our show. That'll get your heart in shape, right? Doctor?
I certainly agree.
Yes, indeed. So, especially if you watch the video with him on the show. So Dr. Mark Colligan is here to tell more about the importance, and the 25-cent name is Heart and Vascular Rehabilitation. In layman's terms, what's that mean?
Okay, so we like to call it cardiac rehabilitation, and it's offered at Downtown Baptist as well as a second location in Stone Oak that's going to be opening up at the end of the month. And quite simply, it's a monitored outpatient-based program, the main component of which, of course, is exercise training, where patients receive this training in a safe environment where they're monitored. And
now, this is not my workout regimen
this is not
to
your
get
workout.
in shape.
That
this
is
for
correct.
Somebody that has had
This is a phase 2 program after a patient has had some sort of event. And the events that they could have had would have been a prior heart attack, a revascularization procedure such as a stent, which is a metal scaffolding that opens up a blocked artery, bypass surgery, congestive heart failure, stable angina, or heart transplant patients are all candidates for this therapy. Okay,
and we've got a full screen up here to talk about who it is, and just like what you have talked about there. So how soon after somebody has, coronary bypass, that's when they're cracking open the chest, but you want to get them going on this very quickly, right?
We want them up walking right away, usually day 2 or 3, and that's considered phase 1. But this phase 2 program usually starts about 2 months into their recovery after heart bypass surgery. Sometimes it starts a little earlier after a heart attack or stent, which is less invasive. But in generally, it's 36 one-hour sessions, usually 3 days a week for 12 weeks, and that's considered phase 2 cardiac rehab. And the team encompasses physicians, nurses, exercise scientists, nutritionists, and even psychologists.
Okay, what else, and we've got another graphic here, can folks expect from this program?
Well, exercise and education sound great, but what does it really translate into for the patient? And that's the most exciting thing about cardiac rehabilitation, is there's been studies, numerous studies over the last 10 years showing a reduction in mortality. In fact, at 5 years, someone that's had a heart attack has a 50% reduction in mortality compared to those patients that didn't undergo cardiac rehab. And then you get all the other benefits, such as reduced hospitalizations, reduced recurrent heart attacks, quality of life improves with cardiac rehabilitation. And this has all been proven in good medical studies.
I remember in the past, if somebody had a heart attack, it was pretty much, that almost two and a half strikes against them right there.
Yes,
but that's not the case anymore, obviously.
50 years ago, they recommended bed rest for 30 days after a heart attack. So we've come a long way, and we know that exercise is very important with the heart recovery.
We saw folks on a treadmill, which, do that at the gym. Most everybody does, but it's a different, obviously, workout regimen and different times and paces, and you're not trying to sprint on these things.
No, they're not trying to train for the mini marathon or half marathon. But patients do get to that point where after they've completed 12 weeks, they can actually go to phase 3, which actually is long-term exercise training, some of which may do pretty intense exercise.
Okay, and you've got a free health campaign running this month?
Yeah, it's called 28 Days of Heart, and I think the website is up there, but it's basically every day you can receive an email tip on some sort of heart-healthy lifestyle change or recommendation.
Okay, well, for more information on the cardiac rehabilitation program, you can call 833-277-5999. Once again, that's 833-277-5999. Or, as the doctor said, go online to bhshearts.com.